The Board of Healthcare Funders and the medical scheme industry is, it says here, to be acknowledged as major players in the South African healthcare environment, and the BHF is holding its annual conference in the Drakensberg at the moment. On the line now, the MD of that institution, it's Humphrey Zokufa. Humphrey, it must be chilly at night up in the Drakensberg, and hopefully you don't get a cold, and hopefully if you do get a cold you can go somewhere that is efficient in treating that. I mean, before we talk about what's happened with the conference last night and the Premier's address, which I think kicked off the conference yesterday. Yep. The basics are, as far as I can see as a layman, SA needs affordable healthcare and efficient healthcare for the whole of the population. And secondly, in order to achieve that and in order to get an efficient sort of transition to NHI, there needs to be very close public and private participation. Is that correct?
That is correct. There is no other way here. All South Africans must see this as something that has to be achieved to the benefit of all South Africans. Not only have an oasis of certain people benefiting it and then have the large majority of people not benefiting from it, because those two tensions there are going to make this country unstable. And also the economic growth of this country is very much linked to how healthy we are. So if we are looking at growing this economy, we have to invest in healthcare, and we have to have a system that makes sure that the people of this country are healthy, because that's the asset we have as a country.
Yeah, it's a fundamental right for everybody to receive healthcare, I believe, coming from England and having the National Health Service, and it's a basic part of our lives. I mean, it's absolutely crucial. You say here that the theme of the BHF conference, which you're attending at the moment and hosting at the moment, is the power of now into the changing future. What do you hope to achieve this week?
What I hope to achieve this week is for the majority of people that are active in the private healthcare financing industry, and also the providers in that industry, but mainly they're those who are medical scheme administrators, principal office of medical schemes, board of trustees, managed care organization, to realize that what they have been involved with in the last 40, 50 years has positioned them in such a way that they are powerful now when it comes to resources, skills, and expertise. And that power has to be realized, but not abused going forward, but be used in an appropriate way that will support all the initiatives that the minister is ushering in that are changing the healthcare system in this country. So it must not be left to the minister, the Department of Health, and government for all of that to happen, when actually in the industry right now there's a lot of power residing there that can be unlocked and be made useful, constructively supporting the initiatives of the future that will shape the healthcare system in this country.
What did Dr. Zweli Mkhize say last night of interest to you when he addressed the conference?
What is of interest to me is for him to acknowledge that the theme, the power of now into the changing future, is an appropriate one, because that theme can be easily interpreted badly, that the medical scheme industry and managed care organization administrators are positioning themselves in an arrogant, aggressive way, and that doesn't go down very well. So to understand what we really mean by the power of now is not something that we are going to be used or abused in an aggressive and arrogant way, but used in a positive way. For him to attest that the theme is appropriate is very encouraging. And then, of course, he reinforced the whole idea of the country moving forward towards national health insurance. And then more importantly, he then said, for national health insurance to really find traction, we need to start at the basics, where the communities live, be able to educate the people so they understand the health status, so they know how to behave, what to do and not to do those things that promote health care, and be aware of those things that happen in their lives where now they could go somewhere and seek for more health care needs. If we do not conscientize the communities around those issues, things like if you smoke, if you drink a lot, if you're violent, if you are not gender sensitive, and if you don't take your immunizations, and all those things that prevent health care, if communities are not sensitive to those issues, you can bring in NHI, but it will not find much traction if that is not in place.
Humphrey, do you agree with the idea, the very laudable idea of NHI? And if so, I think we all do actually in principle, how far are we away from this being implemented in an efficient and equitable manner?
it's difficult to know the timelines, but from what has been said by the Premier and also this morning by the Minister of Health, clearly there are many hurdles to jump before we actually get to the establishment of the fund itself. There are many things that have to be done along the way, and once those things are done, then the real fund itself can be established. And the Minister mentioned the revamping of the public health institutions, like, for instance, the hospitals, the establishment of the primary healthcare system, because you can't introduce NHI in this state of affairs where the public hospitals and public healthcare services are not as good as they are, because you will then be relying on private healthcare sectors, and that will just take away of a lot of the funding in NHI. So the public healthcare system has to be the backbone of this. So a lot is done to do that. Now, put 2 years there, put 3 years there, I don't know, but there's progress there. Then, of course, it also says we have to regulate the pricing of healthcare systems and products in the private sector. For instance, what doctors charge for their services and the various activities related to diagnostics, those are not regulated. So they have to be regulated in one way or another so as to cap that price, to bring about certainty. Now, to do that, he is saying that maybe a regulatory framework has to be in place, and of course the Competition Commission has to reverse that decision that it made in 2004. And he's engaged.
Humphrey, I'm afraid we're going to have to leave it there. I know you're very busy as well and you need to get back to the conference. Very good luck over the next few days with the rest of that conference, and let's hope that everybody comes out smiling with some solutions. That's Humphrey Zokufa, who is the MD of the BH.